Well, it's not just us. The entire state's seeing an explosion, and actually the entire Midwest. I'm not sure about exactly what's happening on the coasts, but the entire region has had a massive upswing in positivity rate and rates of infection, with a corresponding increase in the rate of hospitalizations. It's the highest it's ever been since the pandemic started. One of the things we monitor is the rate per 100,000. They take a population. For example, say the county has a population of 10,000. It takes a factor of 10 to raise that to 100,000. So they would take the number of new cases over the previous 7 calendar days and multiply it by 10. That's your rate per 100,000. On Tuesday, our rate per 100,000 was up to 763, which basically means for us and our population of a little under 10,000, that means we got about 70 new diagnoses of COVID within that 7-day period. Putting a stress on the hospital systems. We are highest rate of hospitalization ever since we started tracking the pandemic, which leads to decreased bed availability. On the IDPH website, statewide, they talk about 30% of hospital beds are open, but that doesn't take into account whether those hospital beds are at a critical access hospital or a large facility, or if the facility has ICU capability. We just don't know. That's just straight up places to put people. And also with the pandemic hitting us hard, we're also having problems staffing. We're actually, we're licensed for 25 beds under the emergency. We can go up any amount we can staff, but to be honest, some days we can't even staff the full 25 beds. And that also leads to another big concern here at the hospital is that with the larger healthcare facilities being full or getting full, sometimes they're not able to accept transfers. So there's a very real possibility that if you get COVID, need hospitalization, you might end up being hospitalized here. Not that there's anything wrong with that. It's just we don't have ICU capability, and we do have a limited number of ventilators. But like I said, the thing that is frightening is if we don't get this slowed down and we just continue to stress the healthcare system, you could literally be on a ventilator here at Palo Alto County Hospital, and we have staff and we have the equipment to handle up to 3 of those patients, but that's it. And we're not used to dealing with critically ill people. That's the benefit of being in a network, is we always have Mason City to lean on. Well, in this case, we might not. So that's kind of terrifying for me. There's been a lot of news about a Pfizer vaccine that was supposedly 90% effective. It's still in trials. It's nowhere near approval yet. We have no idea when a vaccine will be approved. There's still a number of them under development. So like I said, we have no idea when it's going to be available. But we do have plans in place to distribute and administer the vaccine when it becomes available, from the national level to the state level, and even down here at the local level. We already have plans in place. We're just waiting on the product and approval. Really kind of the same things we've been saying all along. Good hand hygiene, trying to stay away from people, obviously staying home if you don't feel well. Don't go to work, wear your mask. And something we've seen recently is recommendations for a surgical mask or any kind of mask are never handle them by the front, always handle them by the ear straps. And you notice when I'm tucking it under my chin, I'm getting inside my mask because the outside is contaminated. If I'm talking to somebody who's not wearing a mask and particles come out of their mouth and they hit my mask, then this is contaminated. So when you take your masks off, you should always take them off by the ear loops as well. That's a big one. With the holidays coming up and everything, consider alternatives. I know the CDC just came out and said consider holding a virtual Thanksgiving. Obviously, not everybody can or wants to do that, and that's understandable. But definitely if you're not feeling well, or if you know you've had an exposure to a positive patient, please consider staying home and not taking that to a family gathering. But you can always find it right here on our Facebook page. Also, I am on the IDPH and CDC websites daily. It's where I get all of my good information. And of course, if you ever have any questions specific, you can always call the hospital at 852-5500 and we'll do our best to get your questions answered.